Hi, this is Valerie Yurich with the Harney County Veterinary Clinic in conjunction with Eastern Oregon Ag Research Center. This Eastern Oregon Ag Minute will cover what to have on hand and do for foaling season. Have a foaling stall with straw or area available and make sure the mare is familiar with it before foaling time. Once the foal is born, dip the navel in dilute iodine or chlorhexidine solution to prevent infection. Have a string available to tie the cord if it is bleeding. An E. coli antibody paste should be given immediately at birth to help in prevention of possible fatal E. coli diarrhea. An enema may be necessary to help pass the meconium or first feces if the foal is unable to do it himself. If it is cold, have towels to help dry off and a heat lamp to help maintain body temperature. Thermometers are very useful to use to monitor the foal's temperature. Most important, make sure the foal stands and suckles and ingests colostrum, which is the first milk that's rich in antibodies, as soon as possible after birth. They are normally up in 1 to 2 hours. Don't assist the foal if no obvious problems are occurring. This Eastern Oregon Ag Minute will cover how to recognize foaling problems and when to call the veterinarian. It is uncommon to observe the actual foaling process because it normally is over in about 20 minutes. Don't interfere if there are no problems occurring. If it takes more than 20 to 30 minutes for the foal to appear after the water breaks, there may be a problem. If you are unfamiliar with how to assist the mare, call for help. If the foaling process occurs without mishap, there are still problems to watch for. Weak, unresponsive foals need to be checked out immediately. If it takes more than 2 hours to stand, or they haven't nursed 4 to 5 hours after birth, or if the foal is straining to urinate or defecate, call your veterinarian immediately. If the mare is bleeding excessively, has a uterine rupture, prolapse, or tearing, or if the placenta is retained, call your veterinarian. Normally, the placenta is expelled immediately after the birth of the foal. If it takes more than 3 hours, it is considered retained. Manual removal by a veterinarian needs to be performed as soon as possible. If not, the mare can become septic and become foundered. Your veterinarian should do a well foal check 24 hours after the arrival of your foal to make sure everything is normal with the foal and the mare. You can always call your veterinarian with any questions that you may have. It is better to be safe than sorry.